Thank you. Okay. I hope we should start, not so, Sejan?
Yes, we can do that while others will join soon.
Yeah, because I see the number in the waiting room keeps on trickling. Maybe for the sake of time, or must we give 1 minute? Will it be fine? Or should we start right away?
Yeah.
Hello.
Hello? Hello? Somebody
Hello.
want? Yes,
Okay.
Ashton,
Yes.
you can go ahead.
Just to greet you.
Oh, thank you. Thank you. Thank you. Okay. Thank you. Okay. Welcome everyone to the session today, our first session of strengthening interprofessional education for HIV. You are all welcome, and we need to know each other now. I am with, I'm Selina Mdau from the University of KwaZulu-Natal and a senior lecturer in the nursing department. I have been in Stripe since 2019. So I think now we need to introduce ourselves. I'll be the facilitator of the day, and I'll be co-facilitating with Sejan. And Sejan, can you introduce yourself?
Yeah, good day, everyone. My name is Dr. Shegun Showande. I'm from Nigeria, University of Ibadan. I'm also a senior lecturer in the Department of Clinical Pharmacy and Pharmacy Administration. I've been a facilitator for Stripe since 2019 too. I guess myself and Selina were about the same age in this program. Thank you, you're all welcome. We look forward to excellent learning today. Thank you.
Thank you so much. According to our short program that we are having, we are to do short introduction, self-introduction of our participants, and it's going to be very short. Sergeant, can you take us through how we are going to introduce ourselves?
Okay, before we do that, before the learners will introduce themselves, I think we would also like the co-facilitators to also introduce themselves. So we'll start with Ray. Ray, please.
Welcome, everybody. My name is Ray Maharaj. I'm actually a gynecologist, but now I'm a Stripe facilitator, so I'm not a gynecologist today. So I want to offer a warm welcome to all of you. You're going to find it very interesting. So just sit back, relax, be very interactive. Don't be afraid. Say what you want to say, and we all learn together. And it will be very useful for you. Thank you, and welcome once again.
Okay, Ivan, over to you.
Thank you very much, and good evening, everyone. My name is Ivan Mugisha Tarema. I come from Uganda. I'm a senior lecturer in the Institute of Allied Health at Clark International University. I am happy to be facilitating the Stripe session, and I'll be able to take you over for the coming sessions of the coming week. Thank you very much.
Thank you, Ivan. Jennifer, over to you.
Yes, good evening, everyone. I'm Jennifer Amongi, and like Roy mentioned, for today, I introduced myself as a Stripe facilitator, but I work as a regional quality improvement officer in Uganda, and allow me to welcome all of you to this very exciting facilitation and for learning for this particular topic that we have here, module. Enjoy and be ready to learn. Thank you. Back to you.
Thank you very much for that. Those are the co-facilitators that we have, but in our midst today, we also have the lead facilitator, if I may refer to her as that. So we'd like Marike to also introduce herself.
Mariki, I'm a family physician from South Africa. I'm the stripe coordinator. And today I don't have to do anything because we have these wonderfully trained facilitators that are going to take you through the module 1. Thank you.
Thank you very much, Mariki. So the learners, we would like you to write in the chat box your name, your institution, your profession, and of course, your country. Could you do that, please, in the next 1 or 2 minutes? Thank you. Your name, your institution, your profession, and your country. Let's do that in the chat box. Over to you, Selina.
Thank you so much. Thank you so much, Sejan. Thank you so much, co-facilitators. Just as we are writing our names, you're writing your names. I just want to remind you that we are in this course, which is time sensitive because we have limited time.
I'll call you later. I'll call you later. 90
minutes, and then we are to use this maximally to achieve all our objectives. That's why we seeing that it's better that you write on your chart, on the chart, and I'm not seeing any writing going on here, and I'm worried. Yes, now I'm getting the first writing. I have Sidzo July from the University of Botswana. Yes, a medical student. Thank you, Sidzo. Kayla Muyendane, Medic MD from Maputo. Hey, it's running, yo. It's jumping a lot. What's going on? Let me go well. Tulufelo Dibokwe from the University of Botswana, Gaborone, medical student. Teboho Binda, medical student, University of Botswana, welcome. Kaile Mwendane, MD, Maputo, Mozambique, thank you. Luane Magwaza, University of Botswana, MBBS student, thank you. Tite Dembele from Mali, in Hospital de Mali, thank you. Evelyn Chilembe from Kamuzu, Malawi, University of Health Sciences, thank you. Mabaledi Malema from Botswana. We are really blessed with the people from Botswana. Thank you so much. And Edwin Tsitsi from the University of Botswana, a lecturer in the School of Nursing. Thank you. Tsepiso Wilson from the University of Botswana. Thank you. Pauline Mutware, pharmacist from the University of Kinshasa, Congo. Tandi Mwalukomo, Kwamazu University of Sciences, Malawi, welcome. I think okay. Oh, it's Ren. Francis from Uganda, practicing statistician, welcome. I love the variety that is in here. And then Bilkiso, project manager of malaria research, University of Health Sciences Technologies, Bakumo. Thank you. I'm trying to summarize for the sake of time. Pauline Mutware, I think pharmacist from Congo. I did mention this one. I think I went through all, and you are all welcome. And we can see that we have a variety of professions among us: statisticians, pharmacists, medical students. We're missing nursing, we have one from nursing school, yes, but we're missing other. But at the end of the day, we will end up with the interprofessional collaboration in this section. Thank you so much. We are on module 1 of this course, which is new diagnosis in a woman of a childbearing age. Can you take us to the next slide for the objective? The objective, yes. The objective is to demonstrate how to support an individual newly diagnosed with HIV with the aim of improving linkage of care and rapid ART initiation for all patients. I have to put this disclaimer that you may be having a different kind of a scenario with you, but don't worry, let's use the one we are having as facilitators. So we are to achieve this objective through a role play as one of our learning strategy. And Sejan, can you take us through the role play?
Thank you very much, Salina. Okay, I'm sure the student, I like to first of all point out that you are expected to have gone through your pre-knowledge activity before this Zoom session. So we encourage you to do that if you have not done so. Okay, so we'll do a role play, we'll go into breakout rooms, and what we want to demonstrate essentially is how to support a patient who is newly diagnosed with HIV, especially with emphasis on linkage to care and initiation of ART. Next slide, please. Next slide. Okay, so this is the case that we would be working with. Blessing is a 24-year-old woman who just tested positive for HIV at a routine visit to our local clinic. She's now being counseled by you about this new diagnosis and its implication for her health. As part of this initial interview, she informs you that she intends to eventually start a family and cannot afford not to work. So this is the case we want to work with. And what we need you to do in the breakout room is that one of you will act as the physician and the other person would act as the patient. Now, it depends on your profession. If your profession entails you to not, you can simulate it. So we want to know how you would the patient to care and then initiate ART. That should be done for 5 minutes in pairs. And then of course, depending on the number of persons in the group, we can pick another 2, one of who will act as a physician, then the next person would act as the patient. I hope that is clear enough. Next slide. Okay, so this is just what I have expected will take 5 minutes in each, 10 minutes maximum, but 5 minutes and we'll switch role. The co-facilitators will help us with that. So Winifred, we can go to breakout rooms now, 10 minutes max.
The rooms have been opened.
Thank you so much. We're all welcome back. I hope we had a nice time with the role play in our different breakout rooms. It was quite interesting in our room. We didn't have enough time to wrap it up. We actually did just one. So Selena, do we give, because of time, do we give each room 1 or 2 minutes to just tell us what the interaction was like?
Yes, please.
Okay. So if we're in room 1, I would like one of you to just tell us what was it like? How did the patient and the physician handled the news of the HIV diagnosis, the test results, and how was the patient linked to support group and care, and was there any advice on ART initiation? So can we have group 1, please? You just have 2 minutes. 1 minute there, Rod.
Yes, thank you very much. For group 1, was in group 1, this is Jennifer. And I think Malema, would you like to speak to this?
Okay.
Please speak to this, Malema.
Malema, we're waiting.
Is Malema here? Okay, Malema was the patient. Maybe you can try the physician, Francis. The physician, Francis, please. Could you?
Thank you. Thank you. They were all a little bit disrupted. We didn't finish the whole session, but received the patient. She acknowledged like she got the results a week ago, but she was not linked because she wasn't really into that. At that time, she could not believe the results, but she came back and said, now I'm here, I'm ready. And we were trying to advise her that about the partner, because this is a lifetime treatment that you're going to start, and we needed your partner such that the family is also aware, such that you have a happy family, HIV-free kids, and that would all actually benefit them as their family. And that is where it ended. Thank you.
Yes, back to you, Chair. Selena, back to you.
Oh, I didn't get it, sorry. Okay, fine. Evelyn, can you share quickly how it went in our room?
Thank you. In our room, it went on well. We had a patient who was newly diagnosed with HIV, and he was still in denial. He said he wanted not to stop to go to work, and he wanted to start a family. So the physician was trying to convince this patient that having HIV is not the end of the world, but she has to observe the precautions in terms of taking the medications and going for follow-up visits. Thank you.
Thank you so much. Sagan, back to you. Sagan, back to you.
Okay, sorry. Ivan, over to you, please, for group 3.
Okay, thank you. So for group 3, we were able to have one pair that did the role play, and what was true is that the person was diagnosed. Incidentally, like most of us will believe, it was not the news expected, and she was not very happy, but we also didn't have so much of the options. Because of the denying circumstances, we knew that she would benefit a lot from sufficient counseling, and also if she's linked into care. And although time did not allow us to do as much as we needed, we have emphasized a bit that because this is the actual perspective of the patients that will come across mostly, we need to emphasize the issue of proper counseling and then eventually engage into care. Thank you very much.
Thank you. And the last group, group 4. Ray, were you in group 4? Or was in group 4?
Group 2. I think I was in group 2.
Okay. I'm not sure we have heard from group 2.
No, we haven't. But I can say.
So who is going to speak for group 2?
We had Sitsi can speak. The other guys had issues with connection. But Sitsi was able to.
Can you pick any of the learner to talk to us, please?
Sitsi, can you please respond and just describe what you heard? What's your feelings about the physician and the patient? Sitsi? Oda. We seem to have major issues with that group in terms of connection. So I don't even know if they are here with us now.
Okay. I hope you had a good discussion there.
Okay. Yes, it was very good. We started late, obviously, because we tried to get people on board, but we failed. So Mariki was a patient, I was a physician. We are building up very nice.
Okay, Selena.
Hello.
Okay, so let's just wrap this session up. It's important that you allow time for the patients to take the result in and acclimatize to it. It's important that the patient is quickly linked to care, and also it's important that ART is initiated immediately. There are several other factors that we also need to consider. I hope we'll be able to do that in other sessions. So Selena, over to you as we go to the next session in the
Thank you. Thank you. Then we're moving to the next activity, which is activity 2, where, not this one, where we are going to do the multidisciplinary discussions. Yes. The multidisciplinary discussion, which the objective is to describe the appropriate interprofessional clinical management and follow-up for a newly diagnosed patient and a stable patient with undetectable viral load. So for this one, we are going to be in the breakaway rooms, where number 1, we are going to talk about the important elements of initial care. Can we get that slide? Where we are going to talk about the important elements of initial care that your health profession would provide for a patient who is newly diagnosed with HIV. This is what we're going to do. What are the important elements of initial care that your profession would provide for a patient newly diagnosed with HIV? For this, we are going to break for 10 minutes. Can you take us there? We are all back. Welcome back. Thank you. Welcome back. And at this point, we are to report back what we learned from the different rooms. What we learned from the different rooms. Let's start with room 1. Who is reporting back to us?
Me.
Okay, go ahead, Kayla.
So at room 1, we discussed the multidisciplinary elements to provide for a person newly diagnosed with HIV and a person who is already virally suppressed. We discussed elements such as multidisciplinary accompaniment, making sure that the person diagnosed with HIV, whether if it's newly diagnosed or HIV suppressed or virally suppressed, keeps doing the treatment, because if they stop doing the treatment or they take the meds irregularly, the disease may progress. We discussed the fact that this diagnosis is confidential, so only the physician and the patient must know, unless the patient gives the physician authorization to share this diagnosis with their family or someone they trust. We discussed the importance of doing the medication, as I said, and we discussed that for patients who are virally suppressed and at a childbearing age, we discussed that the fact that they can be pregnant without transmitting HIV sexually to their partner. We discussed that they need, especially the newly diagnosed people, they need to have a psychological assistance. And we discussed that it is important to make sure that these people have easy access to the medication, so they don't give up doing the treatment. And we discussed the fact that all the doubts, especially for the newly diagnosed patient, must be clarified. Thank you.
Thank you so much. Thank you so much, Kayla. Room 2. Can you add on what they've discussed? Maybe to save on time, we add on what they've discussed. Room 2. It's Roger's room. It's Ray's room.
Didas, are you there? You can say a few things.
Okay, thank you. Room 2, we're able to discuss about managing a newly diagnosed patient, and the approach we saw, we are going to approach this in a 3-pronged manner by looking at the biological, psychological, and social, whereby under the biological, we are going to monitor the viral load, the CD4 count. We do the TB screening, and since she's a young lady, we also do cancer screening, and in the case maybe the CD4 count is below the required or the standard, we go ahead and screen for cryptococcal meningitis. And in the case we do screen for the TB and is not having it, we also initiate him on the TB prophylaxis.
Okay. Thank you. I think we need to get to know what profession was going to do what, so that we get an understanding of the role of each profession. Then room 3, can you take us through what you have discussed in your room?
Yes, thank you. I'm representing room 3, so a number of facts have already been mentioned, but just to add on, somebody who mentioned that we have screened for TB. We are also mindful that other opportunistic infections, including meningitis, can occur in the same population. So we also think that this person should have an extensive investigation for such kind of infections. Then also we mentioned that in most of the scenarios, if it is somebody who is already having a partner, it's also very good that you get to know about the serostatus of the partner. And if it is not known, it is the right time for this person to also be tested so that they can also start care right away. The monitoring tests like CD4 and viral have been mentioned, but in our group we also added that because this person will be on chronic therapy for some time, and these are drugs known to affect the major organs like the liver and the kidney, this person should also be reassessed for the performance of these organs before they are initiated on the treatment. And the concern of sufficient counseling for these people to support the adherence has been so much emphasized. And because in most cases there can also be some psychosocial challenges, especially with the newly diagnosed, we have also mentioned that as these people are being prepared to receive ART, which is a lifetime care, these people should also be able to meet the psychosocial support to be able to understand their challenges and how they'll be able to cope up with lifetime therapy. And then we mentioned that since most of the practice is that these patients will be coming to the farthest health facilities, we should also be able to support them to get treatment a bit nearer, because this can help them to have a good adherence. We don't want somebody to miss drugs because he never had money for transport at some point. And then, of course, we think that also investigation of other comorbidities is very important, like hypertension or diabetes, because we want to be mindful of the drugs that will be given and also make sure that there is sufficient drug-drug interactions which will not cause severe adverse events. And then, of course, when everything has been well done and the patient is able to take up the treatment, this person is started on ART, and then he's continuously supported to make sure that his adherence is good, and then he's able to survive for longer. Thank you very much.
Thank you, Ivan. Group 4.
Yes, most of the points were mentioned, but we firstly noted that you should assess the knowledge of the patient and work with what they know in terms of educating them. So whether on the treatment and whether on the other sexual practices, on the how the infection is is transmitted. So that's how you're going to educate with the baseline of the knowledge. So otherwise you'll be counseling as the doctor or the nurse, and both the doctor and the nurse might refer to the IDCC for treatment, for maybe the social worker and dietitians. And also we should assess for any lifestyle barriers that might come about, maybe cultural practices that might hinder you from having taken the treatment. So yes, that's in the things that we discussed that weren't really mentioned here.
Thank you so much. That wraps the first round of the activity. And because of time, we'll have to move to the second activity in this objective, where we are going to break out for 10 minutes. And we are going to be looking at what initial assessments, medication, adherence, substance use, mental health assessment would your profession undertake in the management of a patient with a new diagnosis, and when would you refer to other members of multidisciplinary team? So we are breaking out for 10 minutes and then we will be back.
Selena.
Hello.
Selena.
Hello, Winifred. Roger. Winifred, can you put me in another group, please? I want to move between the groups. Hello, Winifred or Roger? Zugumi is also sitting here with not being allocated. Hello, Winifred or Roger, can you hear me?
Hello, Marky.
Oh, I hear you. Yeah, you're slow on the. Can you put me in another group each time in a different group so that I can observe different facilitators?
Hello, Mariki.
Thank you and welcome back. A surgeon here. Now we are to report back, and please 1 minute. Shorten the report back for the sake of time. This time we'll start from room 4.
Okay, thank you. So from room 4, we've discussed the management that we will need to do, like screening for the opportunistic infections for the newly diagnosed patient, maybe for TB or others. And then if there's no any contraindication for us to initiate ARVs, then we'll go and go ahead with that. And as part of the initial assessment, we'll do the nutritional assessment and also contraception wise, how the patient is willing to go on with especially if this is a childbearing age woman. And then some situations that may lead us to refer to different multidisciplinary teams. There will be, in terms of like, if the patient is unwilling to start the ARV, then there is an indication for further counseling. And then also, if there is known comorbidities or some obstetric infections, we'll need to refer to IDCC so that for further like workup in terms of like medications to be put on. And then if there's a distance barrier, for example, if the patient there's need to refer the patient to the nearest clinic so that they're able to access the services. And also lastly, if there is need, we'll refer to different NGOs and peer groups that deals with HIV care and support. Thank you.
Thank you so much. I was about to cut you based on time. Let's have group 3 for 1 minute.
Okay, thank you. So we try to differentiate our how our management into different professions. So starting with doctors, initially what they will do, they want to do the lab, as mentioned prior discussion, lab studies might be CD4 counts, viral load, other organ-associated tests. The doctors may also have to rule out any comorbid diseases this patient might be living with. You want to screen for opportunistic infections and also look out for any other thing that you might be missing from the history. And then the pharmacist might help by taking a full medical history for this patient once we initiate them on ART. We want to rule out any usage of other medications, other over-the-counter medications that might have drug-to-drug or drug-to-disease interactions. So if we note such, we'd want to refer back to the doctor to see if there's a possibility of using different forms of medications. Nurses can help by making sure that the patients are adhering, taking notes of attendance of follow-up appointments that might be scheduled for the patient. And then in terms of referral, we're based majority on severity of what the patient might be having and also availability of resources. We mentioned substance use and mental issues can be ruled out by a doctor, and if need for referral to psychiatry would be done as per their assessment. Yes, thank you.
Thank you so much. That was comprehensive. Group 2.
For group 2, we also discussed like the way group 3 has also brought it up. We looked at the different interprofessional teams where we looked at the physician, the dietitian, the lab, the counselor, the family members, then pharmacists, the dermatologist in the case of the skin. Then for the case of the physician here is going to be help us manage in the case there are complicated conditions, e.g. meningitis. The dietitian, we expect maybe if the client has weight loss, it will help us to advise on nutrition. Then the lab will support on doing the laboratory studies, the CD4 count. Then we need a counselor where we'll be trying to prepare the client for pre-admission or in the case maybe stress due to job loss. we need the family members to provide family support and reassurance. Then the pharmacist will be helping us in the dispensing. The dermatologist, we assume the person maybe having skin rash, so we have to refer to dermatologist for management. Then also a nurse will support us in the drug administration and also in sample collection. We are likely to refer this client or this person in case maybe he has a job-related stress, family-related stress. Yeah, maybe my other colleague from the group can also add on. Thank you.
Thank you so much.
I'm still in a meeting.
Additions from group.
Or maybe we should fix it for tomorrow.
We will have additions
I don't know. That's it. I don't know.
So
I would have
again,
loved to
your
finish
mic
it.
is on. So again, your mic is on. Okay, fine. Group 2, thank you. Group 3, can you add on what they have left out?
I think you mean group 1, right? So we have Sandy or Kayla, you can add on what has already been shared.
So for group 1, it was similar. We discussed according to different professions. And maybe just to add, we also said it's important to refer the patient to support groups. For example, fellow patients, to encourage them on how to go through this process, because they end up taking their medications for a lifetime. So they will learn a lot from their fellow patients. If they have reproductive health issues, you also refer them to the right professions. Yeah, that's what I can add. Thank you.
Thank you so much. That was short and straightforward. Did we miss any group? Any group that we have missed? Oh, what's going on? I was cut out. Any group that we have missed out?
I think you have got both group 1, 2, 3, and 4.
Oh, okay, fine. Now we are getting into the last activity in this objective. Can I have the last slide in this activity? The last one, we are breaking again for 10 minutes, where we are going to be looking at what clinical information should be obtained and what questions should be asked of the patient. What clinical information should be obtained and what questions should be asked of the patient for 10 minutes, and then we come back. We are about to close the whole session.
Yes.
Welcome back from the breakaway to the last activity in this objective. Sejan, are you there? Okay.
Yeah, okay.
Okay, can you take it through this one?
Okay, thank you very much, everyone. Welcome back. This is the last activity, so let's give our report. So let's start from group 1. what were the clinical information that you looked at, and what were the questions that you feel should be asked? So who's reporting for group 1?
I am.
Okay, please go ahead.
So the clinical information that we should obtain from the patient relates to other diseases or comorbidities that the patient may have, so we can treat them. Allergies on medication, so we don't give them the wrong medication to this person. And we have to screen the opportunistic infections related to this HIV status. And we should be asking questions about if this person wants to have kids, how many kids they want to have, what do they know about HIV infection, how it is transmitted, how we do the treatment, what are the consequences of not doing the treatment, and opportunistic infections, how many sexual partners do they have, do they use any protection, barrier protection. We should be asking them about the appropriate time for they to take the medication, which is more comfortable for them, and their habits, alcohol, drugs, and cigarettes habits. And if they are pregnant at the moment, we should be asking that or doing the test. And we should be asking about their profession relating to the adherence of the treatment. Thank you.
Thank you very much, Kayla. Thank you, group 1. Group 2.
Okay, thank you so much. Group 2, we also had a similar approach. However, we had to obtain only the clinical information, and this included a weight loss, cough, loss of appetite, diarrhea, drug allergies, a skin rash, vaginal discharge, headache, blood vision, the last normal menstrual period, and the key question is here to ask, we are looking at how long have we been having a cough, which will help us rule out the TB? Do you have diarrhea? And if yes, for how long? Is there any medication that you react to? Do you have abnormal urethral discharge? Do you have any symptoms of anemia? Have you been diagnosed with TB before? Do you have any skin rash? And what is the nature of that skin rash? How long has the skin rash been there? And also adding on to what group 1 was asking, maybe how many sexual partners that the person has. Thank you. That was from group 2. I don't know if another member wants to add on, but that's what we discussed basically. Thank you. Over.
Thank you very much, Didas. That was comprehensive, just like group 1. Thank you for looking at the various aspects of the clinical information. I will go to group 3, who is going to give us a report for group 3.
I will.
Thank you. Go ahead.
So we have similar to group 1 that have already been mentioned. Just to add on top of past medical history, you also want to know if they at this point currently using any drugs, so that we look out for any drug-to-drug interactions. Are they hypersensitive or allergic to any of those drugs? We want to also ask about the socioeconomic factors. Are they currently employed? Should they need to source out medications on their own? Will they financially manage? How are they able to access healthcare facilities? We also wanted to ask about any support system that they have. Do they have any family who would want to be involved in their care, in their HIV care? Similar to sexual partners, we wanted to ask about that so that we do more of contact testing for their partners, also to rule out or just to assess for their HIV status. And then lastly, I think we also want to ask them about their knowledge on viral load, their past CD4 levels, and also know if there are any past opportunistic infections that they've been treated for.
Beautiful. Thank you, July. Thank you very much, group 3. Group 4, over to you.
Yes, thank you. I think they've said the bulk of what we discussed also. So I'll just give our addition. So in terms of the sexual history, our group had also wanted to ask the patient about their sexual orientation, in addition to the number of partners, and to also ask about the history of sexually transmitted infections and whether they'd been treated successfully or not. We also wanted to know about the patient's, if the patient has any risky behavior in terms of their social history, whether they're using any recreational drugs, could be IV drugs, which would put them at risk of other infections such as hepatitis. We also wanted to know about the smoking and alcohol habits. Still with the social history, we wanted to know about the patient support structures. Do they have family, friends that could be with them on their journey to take the ART medication? As you know, support is important. And then in terms of the drug and medication history, we also wanted to know if there are any chronic medications, to also ask about any previous drug reactions in the past, and to determine whether they would have any interactions with the medication that they'll be taking for HIV, and then to also ask about any allergies. For opportunistic infections, we're concerned for cervical cancer, so we wanted to also ask the patient if they've had any screening done in the past. Yes, I think that's it from our group.
Thank you very much. Thank you for that submission, Magwaza. Thank you, everyone, all the groups. We did very well. The information that we gathered was quite comprehensive, and the questions to be asked. Yeah, I think that brings us to the end of the activities. Next slide, please. Next slide. The last slide. Okay, so this brings us to the end of today's module. If you look back, we have been able to examine the full medical history of this patient and medication history too. And in the process, we've been able to look at comprehensive person-centered evaluation. And that is very, very key in the management of HIV, and especially in newly diagnosed patient. Thank you all for participating. Let's also reemphasize that it's important that you do your knowledge quiz, and immediately after this one would also like you to also do your post knowledge quiz. That is very, very important. We'd like all of you to put up your videos so that we can take a group picture now. Winifred, I hope you're ready for us. So if we are all there, we're waiting for others. Okay, we still have Elijah. Who else? Okay, Magwaza. This is beautiful. Can we put up a smiling face? We are not quarreling with one another, so let's give a beautiful smile. So go ahead, Winifred. Yeah. Thank you.
We have two pictures here. So I'm taking the first one, then I will go to the next people. So
okay.
at the count of 3, 1, 2, and 3.
Cheers.
Yeah, I'm taking the second one for the second group. Okay, 1, 2, and 3.
Yeah, thank you very much. Thank you, everyone. I would like to mention Selena, somebody in our group, I think it's Titi. mentioned that he needed the French version. Am I correct, Titi? He needed the French version and it was promised that it would be sent. So he has not been able to do his pre-activity. Can you quickly tell us what the problem is so that Roger can take note of that? Thank you.
Okay, it is that. It is that. Thank you very much.
It is done.
Oh, okay, it's done.
No.
Okay.
Okay.
Okay, so don't forget to do your post-quiz activity, and I think Selena, we can call it a wrap. Yeah.
Hello, before that, Roger, can you kindly please assist? I have been trying to do the pre-knowledge check for module 2. It still doesn't go through. It doesn't check it that I have done it. But when you open it, it will give me all the attempts I have made, which are around 4 now, but still doesn't checking it that I have done it. So I can't continue with others. Thank you.
Okay, Roger is in the house. Roger, can you address that, please? Roger?
Fine.
Okay.
Okay, Titi, you can just stay behind there. You can speak to Roger. You don't keep the other people up.
Yeah.
Mariki, I'm not sure I can hear what you just said. Mariki.
What I said is Dr. Titi can just stay behind to speak to Roger.
Okay. And Edwin too. You can speak
Sorry,
with Roger
Edwin,
directly.
yeah, Edwin.
Okay, so thank you, Selena.
Thank you so much, colleagues. Thank you so much, everyone, for your time and all the sacrifices you made for the success of this activity today, this session today. And I believe that you have learned a lot, that for one patient, we are all involved for the total health of the patient. Thank you, and God bless and good night.
Good night. Co-facilitators, remember to wait behind. Thank you all. Bye. See you.
Thank you.
Bye. See you.
Bye. See you. Bye.
Should I check is Roger? Roger, are you still on? Hello, Roger?
Yes, he's still on.
Oh, hi. Hello, Winifred. Thank you very much for your help. I'm not hearing him. I'm not hearing Roger.
I'm trying to call.
Okay.
He's not taking the call.
Edwin, just don't log off. Is Edwin the one that can't get the pre-test done?
Yes, it's Edwin.
Okay. Okay, just hang on, Edwin. Don't go away. We're just trying to call Roger. Ivan, I think we lost Jennifer along the way.
Yeah. No, she has sent an apology there just now. That the child.
Yeah. And we lost Shagun also for a while.
Oh yes, but he's back full force.
He's back, yes.
No, I've been there. I never left.
Oh, you didn't? But there was a section when Selena did in the big group that we couldn't
find. I
could
not see him.
Oh.
Okay.
See.
We're hiding. Childbearing, you need help as well.
So it's good to have 2 people. Roger hearing?
There's Childbearing here. Okay, she's gone.
I don't know about what about Roger. It seems to not be on. Edwin, I think it's Winifred. What do you think? Will Roger contact Edwin actually to go through the thing with him?
Yes, I think I have to just tell him about the challenge that Edwin has faced.
Yes.
Or Edwin can just write to him.
Yeah, I would suggest, Edwin, that you ask actually that Roger sit with you while you're doing it. And getting it done. And thank you for trying so hard, Edwin. We really appreciate that. Can we see your face? Yeah, there we go. Where you from again? You're muted.
You're muted.
Mute.
Yeah, I'm from University of Botswana School of Nursing under Faculty of Health Sciences.
Okay.
Yes.
Okay, great. Yeah.
Thank you so much for
all of you.
My pleasure.
Okay, all right. So we'll sort you out. Thank you. You can.
He was actually the very first person to do the Module 1 pre-knowledge quiz.
Oh, really?
Yeah, and I think he's only the only one who has posted questions and that interaction.
Right.
Yeah.
But then
He's
if
the
you
only
can
one.
see,
And he did so many.
but if you can see